know all of you are busy, so I plan to do my best to make your time worthwhile. We know some things about me. I think the main things is I have a little bit of a unique perspective because one, I've been teaching stress reduction for about 25 years. And two, I'm a family physician. So I really know the kind of time constraints that a lot of us physicians and nurses have in our office. So the challenge we have is helping our patients deal with stress when we don't have hours and hours to do so. So let's start right in on this with a case presentation. You have a 26-year-old female with a past history of migraine headaches, more frequent for the past 2 months. She says, "By the way, doc, I've been really stressed the last 2 months. Things are really difficult, both at work and at home. Her physical examination is unremarkable." And these are kind of like the headaches she always gets. They're just more frequent. So here's the question. This is what I want you to think about. What would you do for this patient? And really not just what's the right answer, but think about your practice a week ago. What would you have done? One, would you start sumatriptan or Imitrex? It's a migraine medication. Would you say, let's start topiramate or Topamax to prevent her headaches? Second option. C, ask her to do a headache diary. D, discuss her stress more in depth because this lecture is about stress reduction, right? Or E, all of the above, because when all of the above is one of the choices, it's usually correct. So really think about that, not so much, what really has been your practice style. And if your practice style was not to do much stress reduction, I'm going to talk to you about why that might be a good thing to start doing and how to do it. If your practice was to do some stress reduction in the office, I'm hopefully going to give you some hints about how you can efficaciously continue to do that, some extra hints that you can use. So the agenda today, why is stress reduction important? Why bother doing this? Number two, what can you do in a short office visit? And we'll go over a variety of techniques. With each of these techniques, we're going to go over through different case presentations and see how we can apply it in the office setting. And the third thing is sometimes your patient's going to need more, and what kind of resources can you pull into play if your patient needs more? First of all, as a clarification, I am not talking about getting rid of all your stress. Why is that? Because it's impossible. Stress is part of us, as much part of us as our heart. It's a mechanism that we have. And some stress is actually good. It helps us perform better. Maybe no stress, we might be calm, I'm a little kind of too calm to do this talk. Hey, stress reduction talk, everybody, whoopee. Okay, let's go to sleep. No, we need some degree of energy, and that degree of energy that makes us pumped up, that makes us enthusiastic, that degree of energy we call eustress or good stress. You get too much of that stress, your performance drops off. That's when you start thinking, I'm overwhelmed, this is too difficult, there's a knot in your stomach, you're really uncomfortable, and that we're going to call distress. And that's what we're going to focus on, distress. Another way to look at it, one little blip of stress is not a real problem for the most part. But when you have each stressful event, one after another, and the stress gets higher and higher and higher, then we're not just talking about a little blip of norepinephrine and epinephrine. Other hormones come into play like cortisol. And then we get more of an issue with this prolonged stress. That's where we're really going to run into some problems. So let's talk about why should you bother. You're busy, why should you bother dealing with stress? I'm just going to go over, I think, about 3 studies. And there's hundreds and hundreds of studies, of course. I've just picked out 3 that I thought were interesting. This one was interesting because it was a well-done study, and they talked about mortality, death rate. It was done in JAMA, and they looked at 3 groups of people. One of the group were non-caregivers. Second group, a group of caregivers, usually for an elderly spouse. And they said they were dealing with it okay. They weren't too stressed out. But the third group of caregivers said, we're really stressed out. We're under strain. And they looked, they adjusted for all their medical conditions. And they looked over at their mortality for this 4-year period. And let's see what happened. For the non-caregivers and the caregivers not under strain, the mortality was about the same. So the third graph, you see the caregivers under a lot of strain, and they have a 65% higher 4-year mortality in that group. Why might they have mortality? Well, I think a lot of reasons, but one of the leading causes of death, of course, is heart disease. So let's look at a huge study about heart disease. A lot of studies with stress and heart disease. This one's really interesting since it's so large, it's so big. 25,000 people were studied in 52 different countries. The researchers got done with that, and they said, in conclusion, our study indicates that psychosocial stressors are related to increased risk of acute myocardial infarction. For severe global stress, the size of the effect was less than that for smoking, but comparable with hypertension or abdominal obesity. Think about how much effort physicians spend, and nurses, dealing with hypertension. How many medications you see. If somebody comes to the hospital, in their medication list, a bunch of them are usually antihypertensive medications. How much time in the office? How much CME is spent with hypertension? Obesity. How much time do we spend encouraging people to lose weight? But how much time do we spend talking to our patients about stress? I'm guessing not that much, on average at least. Not that much. But perhaps we should. One of the ways stress may increase risk of heart disease, one of the ways, there's many ways, one of those is increasing obesity. Chronic stress increases the deposition of visceral fat, the fat that increases our risk of cardiovascular disease. Why would it do that? Well, physicians really want to avoid putting people on prednisone pills 30 milligrams a day, every day, because of many risks. But one of those risks is because of obesity. It's going to do that. And these high levels of cortisol from this prolonged stress can contribute to this visceral fat. There's also increases in a chemical called neuropeptide Y. People use food to deal with stress, and women with high levels of stress tend to make poor food choices. Now, I'm at the Neuroscience Institute, so I had to include a study that had to do with our nervous system. And one of the real scourges of society is dementia. So can stress increase the risk of dementia? And according to these couple of studies, there was, for the people prone to distress, had in one study twice the risk of Alzheimer's disease, and another study 2.4 times the risk of Alzheimer's disease. Medical conditions that can be exacerbated or contributed to by stress, I'd say basically about everything. We talked about heart disease, irritable bowel syndrome, headaches, obesity, a variety of skin conditions, infertility, major depression. How about premature aging? What do you think about that? You're 132 years old. What's your secret? You must have misunderstood. I'm 32 years old. My secret is I've got 9 kids. Well, a group of scientists at UCSF wanted to look, can stress really age us? So where did they look? They looked at our chromosomes. In particular, the chromosomes are in blue. The tips of the chromosomes are highlighted in white, or stained in white. And the tips of the chromosomes don't have the genetic encoding material. What they do is they protect the genetic encoding material at the end. They're kind of like, if you look at your shoelace, there's that hard part at the end of the shoelace that protects it, and if it falls off, the shoelace can unravel. That's what the telomere does. And as we get older, the telomere gets shorter. So it's really a molecular way of looking at our age. So let's look at 2 groups of women, or they looked at 2 groups of women, exact same age, but different stress levels. And the top graph looks at the size of the telomeres. And you see the telomeres are smaller, shorter in the group under high levels of stress. Why might that be? Well, the people in the second graph, or the lower graph, shows that those group of women had less telomerase activity. Telomerase is the enzyme that repairs the telomeres. And in case you think, wow, that top graph, it doesn't look like that much of a difference in the length of the telomeres, the researchers thought that that difference would be expected to be seen in somebody that was 9 to 17 years older. So 9 to 17 year age difference. Stress in academics, a lot of us have gone through a lot of school. The American College Health Association does a study year after year, and year after year, the number one impediment to academics is, yes, of course, 30% or so. This is interesting. The second, you think about what the second leading impediment to academics was. Anxiety. Isn't that interesting? Number one, stress. Number two, anxiety. Seems like a lot of people are stressed out. Work, the American Psychological Association says more than 1/3 of American workers experience chronic work stress. So now I'm going to shift. Hopefully I have at least as long as I could spend in this talk to you about why you should bother dealing with stress. Now what are you going to do? Well, first thing, you need to be very clear with your patients, because stress usually isn't the sole factor. Usually it's not the only reason they're having heart disease. They're having, they may have high cholesterol, high blood pressure, smoke. There may be other risk factors. But the point is it can exacerbate almost any medical condition. And you need to be careful. So if you tell your patient, you have fibromyalgia, and I think it's made worse because of stress, if you're not careful, they'll hear, my doctor says I'm stressed out and all my pain's in my head. So you need to be very clear that you're telling them, you have a real medical issue. Your pain is real, and the physiologic problems, the physiologic changes that happen because of stress increase the risk of, it can exacerbate your problem. It's not that your problem's all in your head. You have a real problem, but you have high levels of epinephrine, norepinephrine, cortisol, and other hormones. That can make your medical condition worse. So I think as we're treating you with medications, as we're doing other things, as we work on your diet, we should also at least pay attention to your stress levels. So we're going to go over these different strategies. The first strategy is mindfulness. All the rest of the strategies, I'm going to introduce it with a case presentation. Mindfulness is the most complex thing I have to explain, the complex strategy I have to explain. So we're going to start with a little bit of Mindfulness 101. And even if you're familiar with mindfulness, because it's the hot thing in psychology today, even if you're familiar with it, pay attention to how you might be able to speak to your patients about it. So number one is, what is mindfulness? I want everybody here to pick out a time in their life when it was like a peak experience. It was a peak experience. Maybe you're walking down Henry's Beach and it's just gorgeous. The sun is setting. It's just perfect. Or maybe you're surfing and you just caught this amazing wave. Or maybe you're looking into a newborn baby's eyes, your baby, your grandchild, whatever, and it's just perfect. So everybody get a spot at a time like that and think about it, and think how you felt like that. Compare that to our day-to-day life. When we're a bit stressed and we wake up and think, oh, I wish the alarm wasn't going off. Wish my family would be a little different, that work wouldn't be so busy. And there's one thing after another. There's a stream of judgments that come into our mind. And these judgments, we need our judgment to know whether to do something or not do something, but there's a continuous stream of judgments, more than we need, criticizing and analyzing everything we do. Now let's play with that peak experience you had. Let's say it was looking at a beach and walking down the beach, looking at the sunset. If you would have thought to yourself, oh, the sunset's okay, but it would have been better if the purple was on that corner and the orange was in that corner, then it would have been a good sunset. Would not have been a peak experience. It was a peak experience primarily because you had this non-judgmental awareness with it. You're bringing this non-judgmental awareness just to this present moment. So how do we teach patients about that? Well, one of the things that we can start with is talking to our patients about breathing, taking mindful breaths. And I tend to illustrate to my patients what's the different ways of breathing. One, using your diaphragm. We're medical professionals. We know the diaphragm, when it contracts, it flattens, and our abdomen has to go out. That's how we breathe. So I'll show people. Now this is more relaxed. Just vote which is the more relaxed way of breathing, like this with my diaphragm. I'm already more relaxed. Okay. Or this, not using my diaphragm. And they can see pretty much right away that diaphragmatic breathing seems more relaxed. So we work with, that's one of the things to talk to them about, diaphragmatic breathing. The next thing is the steps in mindfulness. And I want you to pay close attention to these. I'm going to go through 4 steps of mindfulness. First step, patiently refocus your attention on a present moment sensation. Now this sensation, as we said, could be a mindful diaphragmatic breath. If you're walking, it could be feeling the ground massage your foot with each footstep. It could be feeling the breeze. It could be you're eating now, really tasting the food. Smelling the aroma of the food, tasting each little bite, as opposed to what we do most of the time, not even know that we're eating. So that's the first step. Patiently refocus your attention on the present moment sensation. Okay. Now the next step, pay attention to, it's patiently refocus your attention on the present moment sensation. And then I really want you to take notes on the third step, which would be, you kind of got the hint here, right? So all we have to do, the key is using the right yardstick. If I were to ask you, I want you to measure the width of a dime, would you go measure it with your car odometer? No, because that measures miles and kilometers. You wouldn't use that to measure the width of a dime. So people get frustrated. They say, well, I tried this mindfulness and meditation thing. I tried it for 20. I couldn't stay focused for 20 minutes. It doesn't work. Of course not. The measurement we want to use for mindfulness or meditation is this moment, this breath, this one footstep, this bite of food. So one brief moment. And when your attention wanders, the important thing is you patiently bring it back. You don't give yourself a hard time. It wanders 100 times in 5 minutes, great. You just gently keep bringing it back. And the more you do, the more practice you get in doing that. You get better at it. Your brain can change to make it easier and easier as you practice things like that with neuroplasticity. So a stressful time, let's say somebody's stressed out, their heart's racing really fast. Boom, 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 boom. The first thing they might do is, I don't like my heart racing fast. Well, my heart slow down, and it gets faster and faster the more they resist it. Second thing they'll say is, if only my boss weren't acting like this, then I wouldn't feel so awful. I'm overwhelmed, and their heart rate goes faster. Whatever physical sensation they have gets worse with resisting it. And perhaps they'll say, they're so tied up wishing that they were feeling differently that they're not even paying attention, and they're going over to grab the cigarette and light it up, and they don't even know that they did that because they're an automatic pilot, or biting their nails, or or going off their diet and eating that cupcake they didn't want to really eat. They're not thinking that, I think logically a cigarette would be really good for me now. Their brain is preoccupied wishing that the present moment were different, and they're on automatic pilot. So what I tell people to do, your heart's racing really fast, go ahead, take some mindful diaphragmatic breaths, and let your heart race as fast as it wants to go. Go, heart, go. Yay. What happens? Ooh, slows down. Because what really had the heart beating faster was that it was this resistance. And then, you don't like how your boss is. Okay, we can discuss some feedback and give your boss later. But you know what? Right now, at this moment, your boss is how he is. So let those thoughts go, and then we'll work on the feedback later. Last thing before we get into the case study, remember eustress. Is there a way we can convert the distress, the bad stress, into eustress? Who here likes roller coaster rides? Okay, at least a few of you. Well, the beginning, less people like the beginning of the roller coaster ride, because that's usually like this. It's kind of like your heart's racing, you're going up top, you're slowly getting higher, you're pounding, your knuckles are white, you're thinking, how did Tracy ever talk me into doing this? You get up to the top, you look down, you know you're going to die. But then you go up and down and side and side. It's like, woohoo, I'm having fun. You're putting your hands up. What happened? The thing is, your body is having the same physiologic response. The heart's still racing, the adrenaline's still flowing, but you're not wishing it away, you're not resisting it. In fact, one of the main ways to convert the distress to use stress is to use stress. Isn't that interesting? Use stress, use stress. So you have the extra energy, instead of resisting it, you use it. You say, oh gosh, I'm not, instead of I'm stressed out, you say, oh, I'm pumped up, I'm ready to go, I have a lot of adrenaline. And you go use that energy, whether it be to go for a run or dance or give a presentation, whatever you're going to do, feel the energy, don't resist it, you use it. So again, with mindfulness, you're going to use the right yardstick, this breath, and you don't resist stress, you can use it. Case presentation, Ted. Ted is 35 years old, and he has a new job. He's having palpitation. In the new job, he's required to make presentation to a board of directors, and he gets exceedingly nervous before and during the talk. Lately, he wakes up in the early morning and cannot get back to sleep. He denies depression. He appears nervous, but otherwise, his exam's unremarkable, normal vital signs. His PHQ-9 score is normal. That's a scoring system that we use for depression, so he doesn't look to be clinically depressed. EKG is normal. Labs, including thyroid studies, are normal. So here's the question. What are you going to do for Ted? Are you going to give him alprazolam? What's your first step with Ted? Alprazolam, which is a benzodiazepine, Valium-type medicine. Zolpidem, or Ambien, that a lot of people use for sleep. Would you give him escitalopram or Lexapro? Or would you teach him stress reduction techniques? What would be your first step? Well, think about that, and think about, again, not just the right answer because this is a stress reduction lecture, but think about what you have done last week in your practice. And let's go over this. Now, what about this idea of giving them Xanax or some Ambien? This is a study out of the British Medical Journal, 2014, looked at about 35,000 patients for 7.6 years for mean. The age-adjusted ratio for mortality use for any of the study drugs in the first year after recruitment was about 3.46. That means about 3.5 times more of the study participants died during the study phase, during this about 7.5 years, if they had used either a benzodiazepine or the Z drugs, the drugs for sleep, like Ambien. Dementia. There's also a study in 2012. New use of benzodiazepines was associated with an increased risk of dementia, and here's about a 60% higher chance. In this one, risk of Alzheimer's disease, about a 51% higher chance. So do I know for sure that it's the medications that are causing increased death and increased dementia? There's a correlation. We can't know for 100% that it's a causal factor. There's some reason to suspect that it may be. And certainly there's reasons, even just the common sense reasons, giving an elderly person Ambien and increasing the risk that they might break their hip. I mean, that just makes sense. So there's some reasons just to take a step back from just quickly prescribing those medications. Do I use them? Do most of us use them? Yes, there are points that I think all of us use them. I just saw a psychologist as a patient the other day, and he was feeling miserable. He didn't understand why. Finally, he was able to get off the Ambien that another physician had prescribed, and he suddenly, all these symptoms that he was having were feeling better. So it's something just to think about. So I'm not saying eliminate them all, but doesn't it make sense to maybe teach Ted some techniques that he will have for the rest of his life? It may take you 5 minutes at the visit, but he's going to have these techniques the rest of his life. There's not going to be any significant side effects to these stress reduction techniques, except feeling better, if that's a side effect. And he's not going to have to take a pill and pay money for a pill day after day. So what are Ted's problems? Palpitations, insomnia and early morning awakening, and he gets exceedingly nervous during his presentations. What are we going to do for him? Palpitations we're going to work up. Because maybe the palpitations are from a supraventricular tachycardia. So we're going to do the usual workup. We did an EKG. Sometimes I'll do a Holter monitor. Other times for Ted, he's a bright guy, I'm going to say, Ted, let me show you how to take your pulse. I want you to go home. If you feel like you're having those palpitations and the pulse is even, regular, and it's between 50 and 100, you're probably okay, Ted. You know, you can be reassured. That doesn't sound like a worrisome medical problem. You're not having shortness of breath. You don't have chest pain. You're probably okay there. Second issue, Ted's insomnia. I think as a basic skill, as a healthcare provider, you should be able to teach somebody meditation. For Ted's insomnia, I'm going to do the regular sleep hygiene recommendations. Not have caffeine late at night, not eat a huge meal, make the bedroom comfortable, those kind of things. And there's lists of those things. That's one of the chapters of my book. I talk about sleep hygiene and different things there. One of the things I'm going to tell Ted is it's important not to try too hard to fall asleep. If you wake up at 3 a.m., instead of thinking, oh, this is awful, you know, I can't believe I woke up now, this is horrible, I'll never get back to sleep, I'm going to feel awful in the morning, my day is ruined, my life is ruined, what do I do? Instead of that, Ted, I want you to say to yourself, wow, what a perfect time to meditate. Because usually I'm really busy during the day. It's quiet now. It's a perfect time to meditate. I'm going to take this opportunity to meditate. And he's much more likely to fall asleep. So I'm going to teach you in less than 3 minutes how to meditate. Okay? Everybody sit up straight. Is it better do you hear me better if I speak like this, or it doesn't make a difference? Is it better like this? Okay. So what I want you to do is just pay attention to your breath. And let your eyes close so you can really focus on your breath. Put one hand on your abdomen. And with each breath in, let your abdomen rise. So feel your abdomen rise with the breath in and relax as you breathe out. See if you can pay attention and enjoy a full in-breath and the full out-breath. As you do this exercise, you're going to certainly notice some thoughts. And that's normal. That's part of the exercise. Every time you notice a thought, notice it like a cloud floating overhead and bring yourself back to the breath, to really enjoying and luxuriating in the full in-breath and full out-breath. If there are any sounds, let those sounds be a signal to go deeper into that relaxation. If there are any body sensations, just allow them to be there. Don't resist the sensations. Just for now, just for this moment, allow those body sensations to be there. And focus back on enjoying the full in-breath and full out-breath. If you are getting the hang of this style of breathing, you can let both hands rest gently in your lap. Now focus your attention on your feet. Let the muscles in your feet soften and relax. Let your legs get very heavy and soft. Let your thigh muscles relax. Your back get heavy. If you have any trouble relaxing a muscle group, just bring your attention there. Let your neck and shoulders get heavy. Your arms get heavy enough that it feels like it would take an effort to move them. Your jaw relaxes. Your face. Even those tiny little muscles between your eyes relax. And feel your whole body soft and relaxed. Now bring your attention back to your breath. Just enjoying the full in-breath and the full out-breath, just tasting one breath at a time. And when your mind wanders, you bring it back to just this breath. In a little bit, I'll ask you to open your eyes, and when you do, you'll notice you do feel more peaceful and more relaxed. So when you're ready, gently let your eyes open. So I think that took me probably under 3 minutes to show Ted and you guys how to do a meditation. Very simple. There's a lot of different types of meditations, but for this one, we worked on diaphragmatic breathing, doing it mindfully, letting go any thoughts and focusing back on the breath. Again, there's other type of meditations, and if it were a longer class, we could talk about that. Sometimes we'll use a repetitive phrase. My favorite is just the word one, because it reminds me that I just have to pay attention to one breath, which is pretty easy to do. Just one moment, that's all I have to do. Real easy. And for this, I did a body scan where we became mindful of different parts of our body and let those relax. Ted also gets nervous before his presentations. Before his presentations, he doesn't have time to do a whole relaxation exercise. Maybe he can, but not sometimes. Right on the moment, he wants to know what to do, and he only has a few seconds when he wants to relax on the run. So, number one, Ted, you know, that energy is actually good. Use that energy for your talk. It's going to be a better, that means you're pumped up. You're going to have the energy to give a great talk, and then go ahead and use that energy, Ted. Because if he tries to resist it, he's just going to do worse. It's just going to get worse. Number two, here's a little trick. I want everybody to do this with me. We're just going to go through 3 breaths. You ready? 3 breaths. When you breathe in, you're going to feel your abdominal breath, your abdomen expanding. Breathe out, you're going to relax a muscle group, starting, let's say, with your neck. So breathe in, feel your abdomen expand. Breathe out, relax your neck. Abdomen, expand. Relax your jaw. Abdomen. Relax your shoulders. One more, abdomen. Relax the little muscles between the eye. Right, don't you just feel a little bit more relaxed from that? So now, that's another thing Ted can do before his talk. Just tune in to be mindful of the present moment, mindful of how his breath is, mindful of his body. And that's another way to be mindful of your body. You know, I never really thought I'd be any good at ballet, but I came up with this kind of cool pose. I call it the Valet Pose. If you remember what a clothes valet looks like, you don't see many of them, but it looks like this. You got a pole coming up and a hanger. You got that? And the shirt goes on top of the valet. Now, right now, imagine that pole is your spine, nice and upright. Your hanger is the shoulders. Okay, feel that? All the rest of your body is the shirt, nice and loose and soft. Okay? What does that do? It has you keep good posture as you mindfully feel your body be relaxed. Case number 3. Sharon, she's 23. She's a receptionist at the medical office. She's stressed at work and tired of patients being rude to her on the phone and at the office. She has irritable bowel syndrome and fibromyalgia. Since she's been so stressed out, her symptoms have been worse. So what are you going to do for Sharon? You know, there's a lot of medications for irritable bowel syndrome, but she already told you it's worse since I've been so stressed out. So let's look at another stress reduction technique we call reframing. Reframing is taking one situation and looking at it a different way. And one of the things that's frustrating Sharon is that people are so rude to her. How dare they treat me like this? Okay, we're gonna fix Sharon's issue with a scientific study I've done with all of my classes, pretty much. And the scientific study involves 2 questions. Please raise your hand. If ever, in your life, if ever you've been rude, raise your hand. Okay. Now raise your hand if when you've been rude, typically it's been when you're happiest and feeling your best. Not really, right? So I've done this with thousands and thousands of people. When people are rude, they're usually suffering in one way or the other. You might not know what's going on. They might have chronic pain. They might have an anxiety disorder, depression. They may have found out that a friend or loved one was diagnosed with cancer. We don't know what's going on with everybody. Actually, we kind of have an insight that our medical receptionists at a doctor may not have, because they come back nasty to the receptionists, come back and tell us about how they're stressed out with caring for their loved one with Alzheimer's and they're really depressed. So sometimes we get that insight. So when people are rude, they're almost always suffering. Where else can we use reframing? How about We talked about one now. I'm stressed out. Well, that has a negative connotation. So we want to use the energy. We're going to say, great, I have a high energy level or a high adrenaline level, and then we can use that energy. I'm a failure. Something goes wrong. I'm a failure. I can't do anything right. Well, luckily for us, Thomas Edison didn't say that. He said, I'm not discouraged because every wrong attempt discarded is another step forward. When the incandescent light bulb didn't go right 100 times, he kept working on it and working on it. He learned from every mistake. That's how science happens. We'd be still going around with square wheels if somebody didn't say, oh, this looks like a mistake, a square wheel. Maybe we could try round, right? That's how we advance. So what can I learn from this as opposed to I'm a failure? An expert is a man who has made all the mistakes which can be made in a very narrow field, Niels Bohr, Nobel laureate. I hate waiting. You're in traffic, maybe visiting LA, or rushing to work. You're at Costco or another grocery store, and you say, I'm going to pick out that line because it's the shortest. You dash over to this line like a linebacker. I'm on the shortest line, yay! You made it, right? Except the line next to you is moving like a greyhound, and yours is moving along like an arthritic turtle in mud. So, but I have an appointment I've got to make. How do we reframe that? So I'm just curious, is anybody here busy? Anybody? Typically busy? I'm the only one? Raise your hand, you're busy sometimes? If you're busy, that time in line, there really is not a lot you need to do when you're in that line. But that time in line can be thought as an opportunity to take a break from your busy day because you don't have to do a lot there. You can do some mindful breaths. You can read one of those magazines in line that we'd never admit to looking at or buying, right? You can list the things in life we're grateful for. You might even talk to somebody in line, whatever. You can use most people these days will probably look at their phone when they're in line. That'd be another thing they may do. Case 4. 45-year-old physician, Ben, complains of being stressed out with both work and home issues. Now, for Ben, a physician is actually, not many people know this, but they're actually people. So all the stress reduction techniques for general people apply. But Ben, there's a special thing for healthcare workers that was really important. Ben was stressed out with work, rushing through his patients, and I said, you have to figure out a way that you connect with your patients, with all of your patients, because not only is that important for your patients, it's important for you. That's why we went into medicine, to connect with people, and that's what provides you your juice. That's what provides you the satisfaction with practice, not just quickly handing out a pill. How do you do that? First of all, there's going to be some patients you're going to have some judgments of. Maybe they can't stop talking, or they take a long time. You're going to have some, they're going to ask me for some drug that I don't want to give them. There's going to be some judgment that you have of some of your patients. What I want you to do is notice those and let them go like that cloud floating overhead and be present. Feel a breath. Maybe on the way to the exam room, you're going to feel the ground on your feet. Bring yourself to be present. Maybe then you'll go into that person and connect with something in common. Yeah, my child went to the same school. Oh, I used to skateboard when I was younger, whatever it was. You connect, and you're actively listening. Now, an important thing in our day-to-day lives now, people just want to pretend it's not there, but the computer is part of medical practice now for most people. We have electronic medical records. You need to have it set up correctly. It's really, there's some office exam rooms I won't want to see patients in because the computer's over here, the patient's over there. Makes no sense. Take the time to make sure your exam rooms are set up right, so maybe the computer's here, the patient's there. You just have to shift your eye a little bit. And that way, you can talk with somebody, type a little bit, be present with them, actively listen, communicate empathy. You want to, as I said, empathize, put yourself in their shoes, but you also want to not only empathize, you want to communicate your empathy. And that may have to do with body language, paraphrasing, that seems like one hard thing after another, that was really difficult. Robert is 67, has diabetes and heart disease, diabetes under poor control since he's often in a rush to get lunch, eats fast food. He has 2 children, 3 grandchildren, very stressed about several business deals. But he's financially well off. I'm going to talk to Robert. One, who here feels like as they get older, time goes faster, right? We're going to end up in our deathbed at one point, and we're not going to look back and say, boy, I wished I worked more. We want to have balance in our life. Well, that's common sense. You don't need to tell Robert that. Well, Robert may need to know that his stress is affecting him. Hey, Robert, do you really need to work that amount of hours? He's well off financially. Does he need to do that? Some patients you're going to do some basic problem solving with. They might not have your education, and there's going to be some basic things you can tell them that might help. You're not going to go into depth as a financial planner, obviously, but you might be able to help them in some ways. Perspective. How can people regain perspective? Everybody hold up your right hand, make a circle. Everybody, hold it right hand. Put your right hand over your right eye and look through it, and then close your left eye. So you're looking through this circle. Put your left index finger at the other end. Now, if you're looking at this, the left index finger is going to be large. There's not going to be much else there. You're going to be able to look at it closely. If it was a situation you're working on, you wouldn't be very distracted. You're going to look at it very closely. If it was a problem, though, it would be huge. It would be humongous. Now, take your hand away. Put the finger way back, all the way back out here, and it looks a lot smaller because you have better perspective. Why do I do that? That's an analogy of how our brain works. Our brain cannot process all of the information at once. There's too much data. We're not thinking, right now probably, how many people are right now thinking about the construction happening, the noise there? Only somebody all the way over there, not most of us. But you can hear it if you listen to it. Or thinking about your right big toe. You can feel your right big toe, but if you don't have gout, you're not going to pay attention to it. So we want to regain perspective. He's maybe worried about his $500 business deal, and since he's looking at it like that, that's his whole world. He needs to take his finger away and say, well, what else is in my world? Would any of you sell both of your eyes for $1 million? Both of your legs for $1 million? So if he lists, he wouldn't have Robert get in the habit of listing the things for which he's grateful, and that'll bring his life in perspective. So what about when you want somebody to have more? Frankly, about anybody could use more hints with stress reduction. Sansum, we have free classes. We'll have them again starting up in the fall. There are 6 hours worth of material, 3 consecutive lectures. Adult education in this town. Mbsr, I think there will be some more Mbsr classes scheduled in the fall. I can put that on my website, stressremedy.com, and let you know about that. Mbsr, mindfulness-based stress reduction, is the most well-researched stress reduction type course, I think, there. They've even had studies showing that through, again, neuroplasticity, there seems to be some changes people can affect on their brains just by practicing mindfulness and practicing it in depth. And individual counseling, of course, that's appropriate for certain circumstance, although sometimes a stress reduction course is what's needed because they just need the techniques, they don't need the in-depth counseling, but that's another thing you want to look at. Another thing you want to be able to do sometimes is flip the classroom. Who has heard the term flip the classroom? It's a new term in education where they talk about have people do a lot of the work at home and they come into the... Oh, sorry about that. Who has heard the term flip the classroom? It's a new kind of education term where they, you'll see in elementary schools even, they'll go ahead and have people do a lot of listen to a video at home, and then they'll come in with questions for the teacher. Well, since we're busy in our practice, sometimes we need to flip the classroom, which maybe have somebody look at a stress reduction book, come in, look at it at home, and come to see you with questions. So now, obviously, I'm going to recommend my own book to my patients because I wrote it for who I think a family doctor, what a family doctor's patients needs to hear, and also included a bunch of sleep hygiene, lifestyle tips, and talking about mindfulness, etc. But there's other books out there in stress reduction. Find one that you like. You can recommend it to your patients, and then have them look at it, come back, and talk to you. And again, my book is, there's Relaxation on the Run is mine, and then there's a mindfulness-based stress reduction book, a variety of other relaxation books. Audio material. A lot of stress reduction techniques. It would be hard for you to learn that meditation if you just read it in a book maybe, right? Easier if I led you through it. So there are places where you can get free meditations. I have on stressremedy.com, I have about a dozen free meditations that you can use, your patients can use. I also, in my link section, I list the websites for UCLA and UCSD's centers as well. They have some meditations as well. So in my audio section, you can get about a dozen. On the link section of stressremedy.com, you can get some more. Here's a neat thing. Let's say you want to make a free app. And you can do this with anything, but in this case, a free app for listening to audio meditations. If you want to, you can get your phones out right now and try this. What you do is you go to the website. In this case, I went to stressremedy.com and clicked on the audio button for there. And that took me to where the free 12 relaxation exercises were. And then right in the middle, at the lowest spot, there's a little thing with an arrow. If you click on that, a page comes up that says add it to your home screen. On some other phones, instead of down there, it's up at the upper right where there's a little thing that has an option you click that says add to your home screen. Do you all know how to do this already? I don't know. So it's good. And then you just, once you click on add to your home screen, then there's a little like app right there. Anybody wants a stress reduction exercise, boom, it's there. And they can be available on their phone. So in summary, stress dramatically impacts physical health, school and work and relationships. Meditation, remember to return to enjoying this breath or this present moment sensation time and time again. If you don't have time to meditate, just be mindful of anything. You can use that thing where we breath in, abdomen, breath out, relax the body part. You can use that Valet Pose. With reframing, if somebody's rude or acting inappropriately, remember that they're likely suffering. Somebody, when you say, I'm stressed out, reframe that. You have a high energy level, use that energy. You have a failure, things not going right. What can I learn from this? An annoying wait. Time out from your busy day. Remember to talk about balance for your patients. Remember, keeping things in perspective, right? You're going to, remember all the things that you could be grateful for. And then know your resources both in the community as far as classes, counseling, books, audio. So again, because you can't do everything in a short office visit. Finally, just to end with, think about why you went into medicine, why you went into healthcare. I think it wasn't just to quickly hand out pills. It was to really connect with people, to care about people. And one of the ways that we can truly do this is help our patients learn about stress and deal with their stress. So thank you very much.